The effects of a provider education program on antibiotic overuse and acute sinusitis, presented by Shauna Berg, Jacksonville State University, Department of Nursing. Despite published clinical guidelines and decades of efforts to change prescribing habits and patterns, antibiotic overuse still exists. Therefore, the problem to be addressed in this DNP project is the high rate of antibiotic prescriptions written by healthcare providers for the adult patient diagnosed with acute uncomplicated sinusitis in the urgent care setting. The purpose of this project is to describe the baseline prescribing patterns of the healthcare provider to determine if the implementation of an educational intervention would change providers' prescribing practices by decreasing the number of immediate antibiotics given. Sinusitis is defined as a symptomatic inflammation of the paranasal sinuses and nasal cavity lasting less than 4 weeks and is one of the most common acute illnesses treated in the urgent care clinic. Patients presenting with the complaints of sinus symptoms receive an antibiotic prescription 80% of the time, with approximately 30 to 50% of those antibiotic prescriptions being deemed as unnecessary or inappropriate. Given the high antibiotic prescription rate, a provider educational intervention may reduce the rate of inappropriate antibiotic prescribed by providers. To decrease the overprescribing of antibiotics, the following PICO question was developed. In an urgent care setting with healthcare providers caring for the adult patient with uncomplicated acute sinusitis, how does a provider antibiotic educational intervention concerning the overuse of antibiotics compared to no educational intervention decrease the number of immediate antibiotics being prescribed? The goal of this DNP project was to lower the antibiotic prescription rate for the adult patient diagnosed with uncomplicated acute sinusitis by 10% through a provider educational intervention. Acute uncomplicated sinusitis is a condition that affects 31 million people annually in the United States and costs billions of healthcare dollars. Those adults who are diagnosed with a sinus infection, 84 to 98% are viral. Urgent care centers have been shown to have the highest percentage at 45.7 for the adult outpatient visit that led to an antibiotic prescription. Antibiotic misuse has been frequently cited as the leading cause of antibiotic resistance. Antibiotic resistance can affect anyone at any age and is recognized as one of the greatest threats to human health worldwide. Providers should minimize unnecessary antibiotic use to combat resistance, reduce allergic reactions, and prevent other unwanted side effects. To reduce inappropriate antibiotic usage, one must identify the barriers which exist influencing providers' prescribing habits. A variety of factors have been proposed to account for the difficulty of changing practice behaviors. Patient demand and the perceived perception that an antibiotic is a cure for most illnesses is just one contributing factor. Other factors include the provider's ability to save time due to the perception that it takes longer to explain why antibiotics are not needed, as well as pressure from the organizational stakeholders to ensure positive customer satisfaction scores. Decision-making by providers is a highly complex, dependent process. Up-to-date practice guidelines synthesizes the most current and best available evidence to support decision-making by clinicians concerning the delivery of health care. However, non-adherence of practitioners to guidelines is quite common. Antimicrobial education and stewardship programs have proven highly successful in reducing adverse events, improving patient outcomes, and reducing antibiotic resistance. One solution to the inappropriate use of antibiotics by providers is through an educational intervention. Education is the cornerstone of antibiotic stewardship process. Implementing a provider education intervention may increase the awareness of the overuse of antibiotics, which could lead to a decrease in the number of immediate antibiotics being prescribed. Successful change initiative uses change theory to implement organizational shifts. The theoretical framework used for this DNP project is Lewin's three-step change theory. The 3 steps of change include unfreezing, change, and refreezing. The unfreezing stage is the preparation needed for the desired change. The change phase involves implementing the desired change, and the refreezing stage solidifies the desired change. The DNP project site consisted of 3 separate hospital-owned urgent care clinics in Bremen, Carrollton, and Villa Rica, Georgia. The urgent care clinic provides acute care for minor injuries and symptoms for patients of all ages. A convenient sample of healthcare providers without any exclusion criteria were asked to participate in the educational intervention. A voluntary consent letter for the DMP project was obtained via email from all participating healthcare providers. In order to measure the outcome of this DMP project, 2 different tools were created. A 10-question test was developed for the healthcare providers to take before the educational intervention module to assess knowledge concerning antibiotic usage. An educational slide module was then developed according to the knowledge gaps gleaned from the pretest. The same 10-question test was retaken by providers after the educational slide module was completed to assess if knowledge concerning the use of antibiotics for acute sinusitis was gained. The project was conducted as a pre-test, post-test quasi-experimental design with a descriptive retrospective chart audit. The project consisted of 3 phases. The selections of chart used for this DMP project was obtained from a 1-month time frame before and after the educational intervention. The retrospective chart audit included the adult patients between the ages of 18 and 65 with an ICD code indicating acute uncomplicated sinusitis. Exclusion criteria of charts included any patient who presented with a temperature greater than 100.3, illness greater lasting longer than 10 days, failure to improve after the initial treatment, comorbidities including chronic pulmonary obstructive disease, asthma, cancer, or any patient on immunosuppressive therapy. The exclusion criteria were based on evidence-based practice guidelines, which included indicators for patients at higher risk for complications, in which immediate antibiotic therapy would be considered appropriate. The first phase, the baseline assessment, utilized a retrospective electronic medical record review to select charts to determine if immediate antibiotics were given. A healthcare provider knowledge survey, the pretest, was conducted before the educational intervention was completed to determine the current understanding of evidence-based guidelines concerning the use of antibiotics in the adult patient with sinusitis. The second phase, the educational intervention, consisted of an electronic educational module available for all participating providers to complete within a 1-month time frame. This 1-month time frame for completion was the month of February 2020. Phase 3 consisted of both a provider post-test and a chart audit. After the implementation of the educational intervention, the same provider test was given to compare scores to determine if knowledge concerning antibiotic usage was gained. A second retrospective electronic medical record review of selected charts that met inclusion criteria was completed to determine if the goal of a 10% reduction of immediate antibiotics was achieved. This DMP project included collecting data using electronic health records. The hospital organizational guidelines, including obtaining permission from the governance board to access patient data, were followed. An electronic health record software program, along with the help of a data abstractor, allowed the patient data to be collected efficiently and confidentially. Chart data were extracted at 2 different time points. The first time point was December of 2019, the second time point, March of 2020. A Wilcoxon-signed rank test was conducted to determine if a significant increase in provider test scores was detected after the educational intervention. A 2-sample portion test was conducted to determine if the percentage of patients who received antibiotic treatment was reduced. The provider test consisted of 10 questions and was scored out of 100. The average score of the pretest was 73.8. After the providers completed the educational intervention, the test was regiven. The average score on the post-test was 86. The Wilcoxon-signed rank test was conducted to determine if a significant increase in test scores was detected after the educational intervention. The results of the statistical analysis indicated there was significant evidence of an increase in the average test score. To address the main concern of prescribing antibiotics when not necessary, 2 variables were created. The first variable was to determine if the patient met the criteria to receive antibiotics, and the second variable was to determine if the patient ultimately received antibiotic treatment. Data was collected via chart audit on patients who were treated by providers to determine if the proportion of prescription medication usage was impacted after the provider's educational intervention was completed. There were 274 patient records that were examined before the educational intervention was conducted. After the educational intervention was completed, 146 patient records were analyzed for comparison. Before the intervention was conducted, 29.3% of the patients met criteria for antibiotic treatment based on symptoms, yet 92.3% were prescribed antibiotics. After the educational intervention, 34.9% met criteria to receive antibiotics. However, 91.1% were prescribed antibiotics. Roughly the same percentage of patients did not meet the criteria necessary to receive antibiotics in both sample sizes. A two-sample test of proportions was conducted to determine if the percentage of patients who received antibiotic treatment was reduced. The results of that data indicated there is no significant difference in the proportions before or after the educational intervention. Therefore, the educational intervention had no effect on the provider's ultimate medical decision-making. The number of immediate antibiotic prescriptions for the adult patient diagnosed with acute uncomplicated sinusitis did not decrease after the provider educational intervention was completed. The overall goal of a 10% decrease in immediate antibiotic prescribing was not achieved. The desired outcome for this DMP project concerning the overuse of antibiotics in the adult population diagnosed with acute uncomplicated sinusitis reveals the provider education module did not change the provider's prescribing habits. While the post-test scores showed an improvement in knowledge, this did not lead to a change in clinical prescribing habits. Continued overuse of antibiotics by providers may be perpetuated by both the cycle of patient demand and the lack of motivation for providers to change prescribing habits. Ongoing educational programs may be needed to increase focus on improving antibiotic prescribing habits of the providers. The limitations of this DMP project included the provider participation size sample was small, consisting of only 10 providers. Because the patient data was retrospective in design, errors could exist in data collection. Also, the number of variables for analysis were limited. In measuring time frame for the patient data only consisted of 30 days. The most significant factor impacting this DMP project was the occurrence of COVID-19 virus, which greatly reduced the number of patients being seen in the urgent care setting for the month of March. Recommendations for clinical practice is to further understand the discrepancies between guidelines and provider prescribing habits, which could create a substantial change. Future education based on interventions on the overuse of antibiotics should be ongoing and focus on both provider knowledge and prescribing habits. Here are the references used for this PowerPoint presentation.